Thank you, Dr. Hess and Dr. Salas. At this time, I would like to share with you an exclusive conversation about climate science and health within the fifth National Climate Assessment, featuring Allison Crimmins, Director of the National Climate Assessment, and Mary Hayden, the Health Chapter Lead for the NCA 5 and a research professor at the University of Colorado's Lyda Hill Institute for Human Resilience.
I'm Allison Crimmins. I guess I started my career more on the climate science side. I began as a paleoceanographer, so I was studying how climate has changed in our past. And when I was studying that work, it became clear very quickly to me. When you study the past, it makes it obvious just how the current changes in climate change are not aligned with what happened in the past, especially the magnitude and the rate of the change that we're seeing now. So that's where I am now as the director of the fifth National Climate Assessment.
My name is Mary Hayden, and I have a rather eclectic background as well. So I started out with an interest in meteorology and a degree in climatology. And then I realized that I actually wanted to make a difference with that as well. So I wanted to see the human impact and got a PhD in health and behavioral sciences. Currently, I'm a research professor at the Lyda Hill Institute for Human Resilience. And I'm honored to have been selected as the chapter lead for the NCA 5 Human Health Chapter.
With climate change and health, we aren't dealing with just numbers on a page or even a perfectly balanced chemistry equation. I think it's different when you're dealing with people. People are messy, and sometimes we exhibit unpredictable behavior, or we have long histories and traumas, or we just have multiple things we care about, our families and our jobs and our communities and our kids' education, that we're all kind of juggling at the same time. So you could map out the perfect solution to climate change, but once you throw people into that mix, it's going to get messy. So that's why you need an evidence-based approach and a really iterative approach so that we can learn along the way and keep improving. And I think it's especially important if we're going to do this together, if we're going to collectively reach for a future that we all want to live in, a better, safer, more equitable future.
We know that there are multiple groups that are currently suffering from disparities, and they're expected to encounter much more severe consequences of climate change, which also continues to have a disproportionate impact on women's health. And so I think that women are more likely to live in poverty. They're more likely to suffer from increased morbidity and mortality from natural disasters and extreme heat events, for example. And I think that because climate change is seen as worsening existing gender-based health disparities, if I had all the money in the world, I think that I would like to see women brought into the picture more. I would work directly with communities, I think, to ensure that the community's priorities are set, that we ensure that they have a voice in what's happening, and that they also are part of the solution.
I'm hopeful that the fifth National Climate Assessment has more art and more figures involved in it. And I think part of the reason we've expanded our chapters to include more social science topics and more authors who are social scientists is hopefully the outcome of that is that people see themselves in the National Climate Assessment. So they don't see climate change as something happening far away to someone else in some far off place. They pick up this report and they see themselves in it, and they see how climate change is already affecting their communities and their families and themselves and the things they love to do. Because I think that's often the first step, and a good reason for indicators as well is that, if you don't see yourself as part of the climate story and don't see how climate change is already affecting you, it's a lot harder to be part of the solution. So I hope that people pick up this report and recognize the things they're already seeing around them with their own eyes, and it inspires them to be part of the solution. What resonated with me was the drought infographic, which I really appreciated. I was a part of some work a few years ago looking at the impacts of drought on dust, and I was shocked by how huge the impacts were on cardiopulmonary illnesses because of just dust. And that figure does a great job of pulling together the kind of many different cascading or compounding impacts of drought, including the mental health impacts of farmers, the vector-borne disease impacts of things like valley fever, all of those different ways that it's not an extreme event like a hurricane that feels as acute. It can be very long running, but have a lot of cascading impacts.
I think that what I'm really inspired by is seeing things happening at a very local level. I live in Colorado, where we've suffered through drought, we've suffered through wildfires, we've suffered through flooding. And I see that even people who were resistant initially to talking about climate change are now coming to the table. We see the ranchers worried about their cattle, worried about their crops. We see people who are worried about even fishing, recreational types of activities. I'm excited to see that people are all coming to the table, coming together to work out solutions to the existing problems we face.